I have to come off mute first, but no, I've just been hanging out in the room. Thank you all for your patience. And yes, as you may have just heard, this meeting is being recorded. Allison also mentioned if you are in a place to turn your camera on, please do so. Like I mentioned, just some minor technical difficulties means I'm switching over to a laptop. So just bear with me if I have a gap or a delay between segments as I'm making sure that I have the right notes. This meeting is being recorded. It will live on our YouTube channel where you can find all of our meetings and trainings. Go ahead and you can change your name, as you can see some of us have. You can also turn on closed captioning. That should be available at the bottom of your Zoom screen. Also, this recording will be sent out to attendees. Along with changing your name, let's go ahead and do some introductions in the chat. Please give us your name, pronouns, and the organization that you're with, if you're with an organization. We'll go ahead and introduce ourselves as well and make sure that we have our emails in the chat. If you don't want to be in today's recording, just go ahead and stay on mute and ask questions using that chat. So we'll be monitoring that the chat, and we'll make sure that we catch as many questions as we can. We want to also integrate that and incorporate it into the community discussion. If you are from the media, we just ask that you check in with the coalition or quote from the coalition staff or official presenters. If there's something else that's an interesting comment that you want to follow up on, please reach out to coalition staff and we can help you get in touch with that agency and the appropriate person there. So again, thank you all for being here. If you're just joining us, we're still in the welcome and introduction portion. We did start just a minute late, and so thank you for bearing with us. And again, for those who are just joining, this meeting is being recorded. Please use the chat for questions and to introduce yourself. Soon we will be moving on to the next steps of our agenda. We'll be doing some coalition updates and announcements before getting started with our first presentation from the Public Health Street team or Street Medicine team. We will then take some time for federal and local advocacy. After that, we will have a program update on the Youth Mobile Crisis Team, and all of that before wrapping up with the rest of our announcements, and as always, having space and time for community announcements from everyone here. So as we get started, as we officially get underway, I would like to invite somebody to volunteer and read aloud the coalition's mission, vision, and values. This is a long-standing tradition of ours, so do I have any volunteers? You can come off mute or go ahead and raise your hand, and I'll ask my other staff members to be my eyes for me if anyone's raising their hand or wants to come off mute.
Yeah.
So again, if anybody would like to volunteer to read aloud our mission, vision, and values.
We have a volunteer.
Oh, great. Go ahead.
Tanita Denard, thank you so much. Tanita's with Mary's Place, so please welcome and thank you, Tanita.
Absolutely. Good morning. So the mission for the coalition, we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Vision, a region that acts on a shared sense of responsibility to ensure that everyone has a home, and the values are equity, justice, and collective action.
Thank you. Thank you so much. And with that, I think we are actually maybe still able to stay right on schedule. So let's go ahead and dive right into coalition announcements. Again, just bear with me while I make sure that I have our announcements ready to go here. Okay. So our first announcement is that we are really in the thick of it for our voter rights education and registration program this year. We are really ramping up to the general election on November 4th. So if your organization or your site would like to explore having a voter rights event, please reach out to me. My email is, of course, in the chat, but it's also pretty easy, kevin@homelessinfo.org. We still have at least a month and a half, and we've got a number of voter rights events and registration events on the calendar already, but we would love to add more. So hopefully I hear from some of you soon. The next announcements here, I believe Hallie is going to take for us. Hallie, are you ready for those?
Yeah, we've got so much going on at the coalition these days. We are hurtling into budget season at both the city and the county. And as part of that, we do a couple advocacy trainings every year, both to help people engage in budget advocacy, but just also to engage in advocacy broadly. So we've got one in-person training coming up this coming Wednesday at 6 o'clock at Solid Ground in Seattle. And we've got another online one October 3rd, that's a Friday at noon. Both of them are free, open to the public. And really our goals for these are to make advocacy feel really easy. We're going to learn how to craft an effective message, both for if you're going to go and give public comment, if you're going to write an email. We'll also learn how to speak up in many different ways in addition to those. And we'll have it, it's open to anybody. Anybody is more than welcome, and we'll have a little bit more like special tailoring towards folks who are direct service providers and folks that have lived experience of homelessness. And we're doing this training in partnership with our friends at the Seattle Human Services Coalition and Statewide Poverty Action Network. So it'll be a great opportunity to learn about how to craft an effective message and how to deliver that message to decision makers as we go into budget season and beyond. So please do share those out with your people, your community, your staff, your colleagues. It's a great opportunity that we offer only just a couple times a year. And also coming up, also in the next couple of weeks, we've got some candidate forums that are going to be focused on human services. So there's one candidate forum that's hosted by the Seattle Human Services Coalition, and that is going to be for Seattle candidates for public office. We'll have both candidates for Seattle mayor there, as well as some various council candidates. And it will be a candidate forum very focused on homelessness and other human services. And that's going to be in person. So it'll be a great opportunity to get a chance to meet those candidates in person and learn where they stand on important issues that we care about. So that's going to be next week, the 25th. That is, the Seattle one is October 9th. That's going to be at El Centro de la Raza in the evening, and we'll grab those links in the chat as well. And then for King County candidates, we've got that coming up next week on the 25th. That one's going to be online at 6 o'clock on the 25th. And that's going to be, we'll have both candidates for King County Executive as well as some King County Council offices. And so these are great opportunities to learn about candidates for really important offices. Like we're electing both a new King County Executive and a Seattle mayor this year. And so both of those offices will have really important decisions to make in the near future. So it's a great opportunity to learn about them and get to know those candidates. And they're free. And the in-person one will have food. So join us. And I think Allison, and then back to Kevin.
Thank you, Hallie. in listening to you and in seeing a wonderful mix of familiar and new names and faces here. I just felt moved to briefly remind people, okay, let's just have some fun with the fact that we have a good number of people on Zoom. So thank you for with your cameras on. How many of you have ever been to a candidate forum, either in person or otherwise? Okay, so I can't see everyone in one window, but you know, some have, some haven't. So let me just tell you a little secret. One of the things that I've learned through years of working as an advocate, both here at the coalition and in other places. The thing about candidate forums is that we think about them as chances for we, the people, the voters, the public, to learn about candidates and to learn about their positions. And that is true. Hallie and others are working hard to craft questions carefully that will get us beyond the sound bites, a very tricky thing to do, and to really get candidates to tell us what their values are and to commit to things that we know are necessary. Things like ensuring that we don't pit shelter creation against housing creation. Things like committing to ensure that public contracts actually are adequate to cover the cost of providing human services in this community. Things like ensuring that wages for human services providers keep up with inflation. Okay, so that's one half of it, and it's real, and it's really a good thing to get to see and hear from candidates directly. Here's the other half. It's for us to educate the candidates. It's for the candidates. And as you just heard, if you don't already know this, which I think you probably do, we're electing the first new King County executive in 16 years. And we are electing a new or returning mayor of Seattle. And there are council member positions, and many other smaller jurisdictions are having elections too. When they come to a candidate forum that is focused on housing, homelessness, human services, behavioral health issues, standing up for our immigrant and refugee community members, we need the rooms to be full. We need them to see a packed house of people, of voters who passionately care about these issues and who are watching and listening and who are going to follow up. So not only do we warmly invite you to participate in person or online for those two forums, but find another candidate forum if those dates and times don't work for you, and show up and bring your people, bring your kids, bring your neighbor, bring the people who are guests and clients and residents in your programs. Lots of times people feel disconnected from elections and from candidates because they don't think that their issues are being addressed. This is part of how we change that. And it's also part of how we educate the candidates. So that's my little pitch for you all.
Thank you, Allison. Yes, we hope to see many of you there. But let's move forward with our agenda and make sure that we're staying on schedule here. I am very excited to invite you all to our next monthly, our general membership meeting. We have two of them, a short meeting online at our normal time and normal space here on Zoom, but also we, in partnership with the Coalition Ending Gender-Based Violence, will be having our first joint and in-person meeting in many, many years. This meeting is going to happen at the end of the month, also on Thursday, also at the same time that we usually meet. And it's going to be October 30th. So costumes will be encouraged, not required. 9 a.m. to 11 a.m. at the Langston Hughes Performing Arts Center in the Central District. Snacks and, of course, coffee and tea will be provided. And like I mentioned, costumes encouraged, although not required. In our mini or shorter meeting that in October, we're going to meet at the exact same time, third Thursday, 9 a.m. We will be talking about our budget advocacy and also our voting rights. So we will have some great content. It's just going to be a shorter meeting. In the longer meeting at the end of the month, we're going to share information about the intersection of homelessness and gender-based violence to really help service providers, advocates, and community members learn how to better navigate both systems and understand the resources that are available to people with complex needs. We will of course always have time for service providers and advocates to share, but also we're going to have time for advocates and service providers to meet and learn from each other and to do better service, better serve people, our communities, and those experiencing homelessness and gender-based violence. And we also want to touch on advocating for expanded resources for our communities as well. Like I mentioned, we'll always have time for community announcements in all of our meetings and to share and discuss, but we'll also learn about some upcoming, we'll have updates on upcoming elections and also how to help your communities register to vote. During this time of year, we are going to be trying to remove barriers and trying to support getting out the vote as much as possible. But yes, that is just that's the heart of the info right now. More details to come, of course. Our registration is open for our regular online meeting. And of course, if you registered for that, then we'll send you the registration for the in-person meeting. Our last announcement before we get into our presentations is for another training that we're holding at the end of October. So also mark your calendars. October 28th is our SSI, SSDI training. This is in partnership with Benefits, or this is in partnership with BLC, Benefits, no, yeah. And
Benefits Law Center.
Thank you. I always get I'm getting my letters mixed up. Thank you, Allison. October 28th, registration is open. Go ahead and check the chat. I believe the registration should be in there. We have a number of people already signed up to attend. If you've attended any of our public benefits trainings in the past, you know how beneficial and how helpful it can be to hear directly from experts, attorneys who are helping clients navigate the system, work through barriers, work through issues, just a wealth of information. And of course, as you know, these benefits and some of the rules around them change from year to year. So there's always good new information to find. If you miss it, please register. You'll get a recap, and then you'll also be sent the recording of it later. But with that, I'm going to hand it over to Hallie to introduce our first guest. We have the Public Health Street Medicine team.
Thanks, Kevin. I just realized I'm not a host, so if I could have Danielle make Shantae a co-host, please. Very pleased to welcome Shantae, and I think you've got some of your colleagues with you as well. Shantae and Gusharn, I may be missing some folks. For our good friends over at Seattle King County Public Health. They are going to be sharing some information with us today about their street medicine team that provides some really important public health resources for folks experiencing homelessness. And I'll hand it over to Shantae. Yes, and we can make Gusharn a co-host as well.
Thank you. So I am Shantae Stubbs. I am the interim manager for our street medicine program. My position is temporary, so you may see a new manager in the near future, but until the end of the year, I am kind of holding down the fort. Gusharn is going to co-present with me and will also be sharing the slides, so thank you for making Gusharn a co-host. While we get up and running, Gusharn, do you want to go ahead and introduce yourself?
Yes, thanks, Shantae. Hi, everyone. My name is Gusharn Betty. I use she, her pronouns. I am program manager on the street medicine team as an operations analyst. So thanks for having me here. Okay. And I think we also have Katie on our team who's on the call, and also Emily.
Thank you. Thank you, Gusharn. I am going to roll through the kind of majority of the first half of the slides, and then I will pass it over to Gersharn to give you more detail on some of our services and how to contact us. And then we also hope to be able to punt to Emily, who is one of our nurse supervisors, if there are any clinical questions. So I'm going to do my best not to hear myself talk for the whole thing and to share the love with my other team members. Okay, so we are the Public Health Seattle-King County Street Medicine team. And we have been through a lot of transition in the last year and a half or so. And so we're really excited to be able to reintroduce ourselves to you. I think some people may previously have known our services to be called the Mobile Medical Program. And that is where we started when we started with a different model. So I will give you a little bit of history on kind of the street medicine team, changes in our mobile medical services, and how we have come to be the newly renamed street medicine team. And in general, our mission, as can be seen in the last slide, Gersharn, you don't have to move back, but is to make sure that folks living unsheltered in King County have access to the care that they deserve on their terms, and to do so via racially just, equitable services that are really grounded in trauma-informed care. Okay, so the original street medicine team was a small but mighty team of 3 people that was launched in October of 2019, and it was a pilot program as an offshoot of our larger mobile medical services. And the larger mobile medical services, for folks who may not be familiar, were comprised of kind of 2 RVs, one that was focused on Seattle and one that was focused on South King County, that would co-locate at other homeless service sites to provide medical and clinical care at, let's say, for example, shelter sites or spaces where folks were already frequenting, so meal service programs, sometimes churches. So anywhere where we thought that homelessness services were being provided, we wanted to try and co-locate with those 2 larger RVs, and they would be pretty much like plug and play clinics, right? Our street medicine team was kind of designed to be the more nimble and flexible branch off of this programming, right? So really being able to send people into spaces such as encampments or spaces that were further away, maybe a little bit more rural, where, you know, you might find folks who did not have the ability to access care in those other areas, right? So really bringing services to people where they were, where they needed it the most. And so I think you can see in the second bullet, the hope was that we are meeting people where they are to provide acute and episodic medical care, harm reduction services, basic needs, and interdisciplinary coordination of care. So again, while we had the plug and play clinics, we also very much wanted to be able to provide services in a different way to folks that maybe couldn't access services in any other mechanism. The primary focus for our street medicine team has always been folks who are sleeping outside. That could be in tents, people sleeping on the street, in RVs, in cars, or spaces that are just in general otherwise not intended for habitation. And that is still kind of the focus of our services moving forward. But for general reference, we do fall under HRSA eligibility of homelessness. So that can include chronic homelessness and being at risk of homelessness in nominal numbers. Okay, the original street medicine team was comprised of a single ARNP, a public health nurse, and a behavioral health outreach specialist. And what we learned very quickly was that it's helpful to have a 4-person team. And so in 2024, kind of after some piloting during the height of the pandemic, where we had a little extra funding and a little extra capacity, we realized that it would be really helpful to have a 4-person team kind of permanently moving forward, so that we could have 2 nurses, 1 ARNP or other provider, so that could be a physician or a PA, and a behavioral health specialist or an education specialist. Either way, the goal being that if you have a 4-person team, that does allow for some flexibility and potentially that team being able to split into 2 separate kind of groups, and then to be able to cover more of a region, or to separate kind of the impacts of their care in that particular day. Maybe one team is doing some kind of follow-up to some clients while another team is serving a different encampment, right? So it really gave us more flexibility, and we were lucky to be able to make the kind of changes to the model early in 2024 and make that kind of our permanent composition moving forward. And after losing some funds during the pandemic and also experiencing some unfortunate budget cuts related to levy reductions, we realized we were not fiscally sustainable in our current mobile medical model. And so we did have to make some hard decisions around pivoting for the sake of creating ongoing sustainability for our programming in the future. So in January of 2025, the mobile medical programs began transitioning the RVs and the plug and play style of clinics, right, with the where we were co-locating with other sites, into a hybrid street medicine model that hoped to gather the best characteristics from both models and intertwine them so that we didn't necessarily lose all of the great work that had been done by the teams on the mobile medical vans or the RVs, but we also still had an opportunity for flexibility and being nimble moving forward and financial stability in the event that we had to weather more cuts. Krisharn, you can move us along to the next slide so that maybe we can help folks visualize some of this. Thank you. So, as we were talking about earlier, we had one street medicine team in 2019. That team is still holding strong, and you can see them on the very left side of your screen. If we were looking at this in kind of like columns, that team has maintained its structure and its personnel. And so that team is on the left side. And then if you kind of look towards the middle, just jump past the second column for me for a second, but look towards the middle where you see Seattle van and South King County van. What we did was, in order to, again, maintain as much staffing as possible under fiscal constraints, and knowing that we needed to make some adjustments for like the sustainability of the program long term, we started to transition the staff on those vans into a street medicine team. Unfortunately, because of the cut from the levy, we did lose a number of external partners that helped in staffing those vans. And so when we say that staff from these two vans have been transitioned into one team, it's internal staff on those vans that have now been kind of transitioned to another street medicine team. And that street medicine team consists of one physician, 2 PHNs, and 1 education specialist. So in the midst of transitioning those teams, we also, thank you to the advocacy of Challenge Seattle, received some additional funds from the state. And the state really is focused on pilot programs in different areas around Washington. And for folks that, don't have street medicine programming or wanted to pilot street medicine programming, there was funding available. We already having a street medicine program asked for funding to expand our services. And so our expansion services were Seattle focused specifically, and the money that we received allowed us to add another street medicine team. So at this point, we have 3 outreach-based street medicine teams. And even though, the funding for the expansion is for Seattle, all 3 teams will roam the county, and our funding is really more site-based. And I can answer more questions about that if that's interesting to anybody moving forward. On the very right side, we're excited to also say that we have expanded services in a different way. In addition to more street medicine capacity and transitioning our van teams into a street medicine team, we had the opportunity to assume a body of work at the Reach Markham Drop-In Center or Day Center. And so we are providing clinical services there as of January 2025. And there is a team there that will be, we're almost fully hired, but there is a team there that once fully hired will consist of an AR&P, 2 nurses, and 1 medical assistant. They will do kind of local outreach in the area, but also provide consistent services 4 days a week at that site. So it's our only true fixed site service as part of our program outside of anchor sites, which I'll talk to you about in a second. Okay, Krisharn, will you push us forward? And I'm sorry, I forgot to mention on the last slide, if you care to look at them when they are sent out to you, there are a number of support staff and operational staff as well that keep our program running and that will sometimes sub in, including our supervisors will sub in instances of shorter capacity or less capacity. So kind of what you're looking at here is our original street medicine van. It's a Sprinter van. And as you can see, there is an exam table. There's kind of some limited seating. And then we've got very minimal storage and a sink. However, it does serve its purposes in providing some measure of privacy and also an opportunity for us to kind of pack the empty spaces ongoing for like supply distribution. So it has been very helpful to us and has been kind of one of the hallmarks of our programming. And with 2 new teams, we realized we needed 2 new Sprinter vehicles or transit vans, because I think they're actually a different model, so the name might be different. But Gershon, if you can push us to the next slide, we're able to see our updated Sprinter vans. So we have 2 new Sprinter vans that have this interior. As you can see, we've kind of foregone the traditional exam table, but you do still get kind of a bit of an exam situation happening in the back there, right next to a chair. Much more storage for us, and I think that these 2 vans also were equipped with a little bit higher grade of technology, so it's made our ability to connect to the internet a little easier, which is very helpful when trying to connect to Epic or when folks are trying to chart, right, or see medical records. And if folks are specifically interested in any information around these vehicles, we're happy to share, but I will not bore you at the moment with those details. Do you want to push it forward, Gershon? Thank you. As you can see on the right side here, this is just an example of how much we will pack these vehicles up with supplies to be able to engage. And if you're noting, there is snow and ice on the ground under this vehicle on the right. And so it is a testament to these services going, continuing even in inclement weather. And quite often we will have folks out providing some level of survival supplies in either heat, snow, or inclement weather. So that's just a little visual for you. Let's move on to the next bit, Gershon. Thank you. To give you a little bit more of a sense of like what a hybrid model means to us, our hybrid models do consist of what we call anchor site services. So I'll explain that in a second. Encampment outreach, and then I already explained the Reach Markham hours. So the Reach Markham hours are our kind of fixed site services. I'm going to go a little backwards here, but they are Monday through Thursday, 10 to 2 is what we hope to staff. There may be some slight adjustments depending on the Reach schedule and or our capacity, but for the most part, that is our goal, is to be there 10 to 2 Monday through Thursday at Reach. Then the 3 teams, the other 3 teams that you saw on the previous visual, will do some level of encampment outreach, and there's a regional schedule that you'll see shortly that we can kind of walk through. But in general, our encampment outreach includes Burien, Federal Way, Kent, Renton, Seattle, and White Center. There may have been some slight adjustments recently, so this might not be the most updated bullet, but we'll see when we get to the scheduling sites. And the fact that we have 3 teams now really allows for a weekly rotation of sites and regions, whereas previously with 1 team kind of serving the entire county, they would have had been locked into a monthly rotation, right? Just it would not have been possible to provide this level of consistency and continuity. So the expansion has really allowed us to kind of lean more into a primary care flavor of work in addition to just the episodic care. And the anchor sites are quite interesting and lovely because they are actually kind of pulled over from our mobile medical van sites. So when the Seattle van and the South King County van were retired, the team went through a process of selecting sites for kind of ongoing services so that, again, we could maintain some of the like best parts of the previous model and not lose that. And so there is a level of continuity from our previous model to our new one. We're still going to select sites that were chosen through an equity prioritization tool and that are kind of, assessed on a quarterly basis. So the sites may change a little bit, but the aim is to make sure that people did not lose access to care at sites that were very heavily trafficked or where there is a strong amount of need or where it just made sense for us to be. Allison, I see you have a hand. Go for it.
Thank you so much, Shantae. I was going to put this in the chat, but I figured this is a good moment. It's really great to hear that. Well, just first of all, the incredible thoughtfulness that you and others have put into making this transition of programming work. I am sorry that it was necessary, but I can see and hear that you're making the best of it. And specifically about these anchor sites because the regular rotation of the mobile medical van, I think, in my experience, especially in South King County, was such an important thing that pinned other resources to it. And you were a really important anchor for other services. Can you tell us where those anchor sites are and how folks in the community might suggest sites for future consideration?
Sure. Actually, Gershon, if you'll go to the next slide, I think it might be the anchor site schedule, so we can
thank
see.
you.
No
Great.
worries. It was the perfect segue. So this is our September schedule. And as you can see, if you visit our website, which is linked, if not here, it will be linked at the last slide of the presentation. We have an anchor site schedule every month, right? And so there might be rotations on a monthly basis. There may be some adjustments, but you will be able to go to the website and see where we will be. And so that is, again, so that folks can kind of have access, public access to where we're intending to be. And if folks have the ability to make it to these sites, then we encourage that they come on down. But you'll see right here, we do have anchor sites in Sodo, Burien, Renton, Kent, Tukwila, Georgetown, Ballard, more Renton, and Gershon, or Emily can jump in if I'm forgetting others that are important, because again, this might change slightly month per month. And we go through the process, or we are now starting the process of assessing our anchor sites, hopefully on a quarterly basis. And so now is the time, if you have suggestions, to go ahead and send them to us. Gershon will go over in the final slide our how you contact us. So there is an email that you can contact, or if you want to reach out directly to myself, Gershon, or Emily, all of whom are on the call, we can maybe paste our emails in the chat, because I admittedly did not put them in the slides. But reaching out to one of us and indicating to us, why you think a site might be a good anchor site, and giving us some kind of justification would be helpful as we consider, and we can kind of run it through our revised prioritization tool. And if it fits into certain eligibility criteria, and if it makes sense, then we can consider it. I will say there is no guarantee. And again, because the model has shifted, we do not have the same capacity to do the entire breadth of sites that we would have done previously. But that doesn't mean that we aren't happy to have suggestions and to kind of recircle to those suggestions when we are thinking about what makes the most sense as we pivot each quarter. Okay, do you want to take us to the next? Thank you, Gershon. And the next, this slide is really also just, and you can find this on our website as well, is our regional outreach rotation. So you can also see, even though it doesn't have explicit listings of what site and exactly what cross sections we're going to be at, it does give you a sense of what region we'll be in, right? And so if there's the desire to refer somebody from a particular region, you can pop on the website and just kind of see okay, on this day, I know that a team is going to be in Lake City on Wednesdays, right? And so this again may adjust just a tad bit, based on capacity, holidays, or other things. But for the most part, this has been pretty consistent, and we will update this if there are changes and as there are changes, right? So just, again, go to our website. You will see the most updated information that we have for both our encampment schedule, which is slightly different from our reach hours. This is 11 a.m. to 3 p.m. So just want to note that. And our anchor sites are really, again, on the other slide, you'll see there's times for anchor sites. Some are going to be later in the evening to really make sure that we are getting, we are being the most efficient in terms of wrapping around and co-locating services. So if, for example, a meal program is set for later in the evening, you will find us at an anchor site, maybe co-locating with that program later in the evening, and they're not beholden to the 11 to 3 time block. Okay. So I'm gonna move us on to the next slide. And actually, I think this is where I'm going to pass off to Gershon to give you kind of more explicit details around our services, which will hopefully be familiar to folks. And there will also be information on there. We often get requests around our dental programming, which has shifted as well since our previous programs, since our previous mobile medical program has transitioned. So Gershon will cover that in detail too. Go for it, Gershon. Thank you.
Thanks, Shante. All right. So with the hybrid model, our main priority is still to reduce barriers to care and meet people where they're at. And part of this hybrid model, it allows us to, as Shante mentioned, be flexible and nimble with the ability of our smaller vans compared to the vans that we had before, but then also be consistent in terms of the locations of where we're going to, and have that posted on our website. So geographically, we're meeting people at their tents, RVs, shelter, wherever they're comfortable within safe reason. And our pre-scheduled clinics allow us to like post where we're going so people can know through our encampment outreach, like the general location of where they can find us, and have it repeated on week to week basis of which team is going to be there, so they know that they can be in that same vicinity to receive the care. And then as well as our anchor sites of having that posted online, so they have like a fixed location and know where they can reach us. And in addition, our Reach Markham building, which Shante mentioned earlier, allows us to have like a walk-in clinic, hopefully transitioning to like for us to be able to provide primary care once we are fully staffed. So we're almost fully staffed on that, and having that open from 10 a.m. to 2 p.m. from Monday to Thursday. So medically, the services that we're able to provide is that our teams carry several non-controlled medications, wound care supplies, point of care testing. We provide STI, HIV, hepatitis C testing, pregnancy tests, birth control. We provide we do Suboxone intakes for opioid use disorder, and we also connect our clients to ongoing care. We also provide naloxone and provide naloxone training and kits. So for we also meet the basic need, try to meet the basic needs of our clients, and provide food, clothing, water, backpacks, sleeping bags, and other hygiene supplies. So we carry that with us, although we have like limited supply of those. Those are items that we carry with us in all of our clinics and during outreach. We also make referrals and connections to other available resources, such as referrals to shelters, food banks, housing, providing resources on legal assistance, for example, enrollment into the Orca Lift transportation assistance, enrollment into health insurance. And, pragmatically, we provide harm reduction resources. We are actively attempting to destigmatize drug use, and we distribute clean needles, glassware, naloxone, condoms, and other harm reduction supplies. And emotionally and psychologically, our goal is to meet our patients where they're at, and meet the goals of our patients, not ours, and provide trauma-informed and patient-centered care. So our mission is to provide collaborative care, and we rely on our partnering organizations so we can ensure the continuity of care to ensure that our clients have access to all the resources that they need when they need it. Although we have expanded and we are now 4 teams, we're still just one program, and there's a lot of unmet needs. So our partnerships with our other organizations are so vital to ensure that continuity of care. Some of the organizations that we partner with are listed here: Reach, DESC, Neighbor Care, Health One. We connect many patients to primary care. We also connect patients to medication for opioid use disorder, including the Hepatitis Education Project, BUP Pathways, and DESC's Opioid Treatment Network. For another one not listed here, but we recently been doing partnerships with the Harborview Medical Center's weekend street medicine team. And these are so essential. Like, for example, for BUP Pathways, that's a new partnership with their mobile BUP team. Is going to be that partnership is going to be very vital for us to collaborate and ensure that we can make those referrals and get our clients access to long-acting injectable buprenorphine. And so for our weekend, an example with our weekend our partnership with the Harborview Medical Center's weekend street medicine team. They work on the weekends. We're Monday to Thursday. So at the end of our week, we have been able to like send referrals to them if there's someone who needs like that continuity of care over the weekend, and we kind of do a warm handoff, and then they will take those referrals and try to find clients over the weekend. And then every Monday we do a call with them where they give us feedback on if they were successful with those and if they have any further referrals for us for the week. So that has been a great partnership. And we also connect to other resources such as referrals to other social services and partner programs, housing assessment, and referrals to shelters or tiny homes. Update on our dental services. Street medicine does not fund dental services directly, but we have been in communication and partner with Medical Teams International, and we have been working with them for future collaboration. So like looking into next year, how we can partner on the anchor sites that we're going to and like have them co-locating there to provide dental services when we're providing the medical care. And so right now, they've been partnering with us at Kent Lutheran anchor site and until the end of the year, and hopefully that will continue to go on until next year and with the addition of other anchor sites. For more information regarding free dental services in King County, please reach out to the Adult Dental Services Program, and that is listed in here on this slide. All right, so on this slide, you'll see our website where, thank you, Laura, also for putting it into the chat. And then you can see our schedule on there and also contact information on how to reach us. This is our phone number that's posted on our website as well, where anyone can reach us at. And then our email. So you can reach us here. We check that daily, and like we also receive referrals on that email. Want to thank Cami Lopez and Shantae for the slides. Thank you so much for all your work on this and providing this essential information. And kudos to the street medicine team staff and street medicine leadership. You all are amazing. So thank you. And thank you all for being here and listening to us. And we will take questions.
Yes, thank you. And thank you all. We do want to make sure that we're staying on schedule. So folks have really been using the chat very well. If you have questions and you want to go ahead and put them in the chat, I want to make sure we can just stay on schedule with our agenda. And Shantae, and if you wouldn't mind just hanging on for a minute. If someone has a quick question, they're coming off mute, by all means, go ahead. But I'm going to hand it over to Hallie and Allison to field those and move us on to our next segment.
Could I actually just make one real quick comment? Hi, my name's Emily Katz. I'm she, her pronouns, one of the nursing supervisors on the street med team. I just about prioritization criteria for new sites. There was a comment in the chat about this and figured I'd just speak to it a little bit more broadly. The sites that we prioritize, it's not an exact science, and we're always open to feedback about it and willing to discuss it. But basically, with our limited resources, like one of our nursing supervisors once did a very rough and dirty kind of calculation about how many street teams might be required to serve the needs of King County, and it was like well over 50 teams, and we have 3. So in terms of prioritization of services, we have to look at things like whether people are sheltered or unsheltered. So we often get referrals to like, would you please be able to come to this permanent supportive housing building? Like there's tons of people that need services, they're medically complex, they have all these needs, and we hear that, we know that those people need services, and we're just, with our limited resources, we just have to prioritize people that are in situations that where they're either like much further away from resources. So that's one of the things that we factor in, like how easy is it for them to access healthcare services, to access harm reduction services, to get to a bathroom, like overdose rates. So the person in the chat had asked if we're at Recovery Cafe, if at any of the recovery cafes. We are not currently, although if you feel like we should be there, then we'd love to hear about it. But just know that like we're not trying to we're doing our best with prioritizing our services, and if we have the sense that people there are getting more of their needs met than say a community of people out exposed to the elements year long, where it takes them 40 minutes to get to a bathroom, like we just have to prioritize that site over
Yes.
a site like Recovery Cafe. So that's always a hard decision, causes a lot of moral injury in our team, but we do our best, but always willing to hear feedback and to push back on us with our decisions around it.
Thank
And
you,
can I just-
Emily. We really appreciate that. And what I will just say that our valued colleagues who work for our public health department cannot say is this is making the best out of a tragically reduced budget for vital services. And we saw during the pandemic what it starts to look like when you actually have additional funding, not adequate funding, but additional funding to serve people. And this is part of the, in my opinion, incorrect, but real contraction of services when one-time, mostly federal funding went away, and when we were not able in our community to backfill those funds. There is so much that this team does, and that does not, offset the reality that there's so much more that we need. Shantae, I see your hand is up. We need to shift to our federal, but I want to give you some time and just recognize that maybe we'll need to have our friends at this newly conceptualized team come back to talk a little bit more perhaps about what we can collectively do to meet folks' healthcare needs.
No worries.
Okay.
I will try and be as brief as possible.
Yes.
Just, I think, Emily, thank you for expounding upon the fact that we cannot guarantee that any site recommended to us will actually be added to our rotation. What we have done in the past, in both times of COVID and when we were transitioning, was to share our equity prioritization tool. And as we refine that for our next kind of iteration, I think we can share that as well, so folks can already get a sense of like, this is how your site recommendation might land. Does that make sense for you to move forward? But we also just welcome, if you have sites in need, even if it's not us that could, provide services there, we are connected and are part of the larger Healthcare for the Homeless Network umbrella. And the admin team is always trying to gather and source spaces and input from the community where they might need to like reshift focusing as we think about new RFPs. So even if we can't pick it up, we will hand it over to folks for consideration in other spaces.
Thank you so much. Wonderful. Well, we are deeply, deeply appreciative, but we are going to rush to our next set of issues, which have to do with ways that our communities are affected by appalling actions at the federal level. So please feel welcome to stay on, folks from the Street Medicine team and Healthcare for the Homeless Network. We really appreciate you, and you may have some follow-up questions in the chat, and let's talk about how we can continue to support and expand upon your good work. Hallie.
Well, you want to go ahead and do federal stuff, and then I can do local stuff after that?
Okay.
Okay.
All right. Thank you. So, look, I said to my team this morning that I was going to try something a little bit new. We're short on time, so please just indulge me. Participate if you can. It's really bad. It's really bad. We are affected by what is going on. Other people are even more directly being under attack. I want to try inviting everyone once again to turn on your cameras if you can, if you're comfortable doing it. And whether you have your camera on or not, you know what I just decided this morning is like, let's stand up. And first of all, just like seriously ground ourselves, just like we read our mission, vision, and values. Oh my God, you all are wonderful sports. Thank you for joining me. Just like we read our mission, vision, and values to ground us in who we are collectively as the Coalition on Homelessness, because you are the coalition. Let's ground ourselves by putting our feet on the ground, wiggle around if that's good for you. I see people stretching. And let us just ground ourselves as we remember we are the people. This country has been imperfect since its founding as a legal entity. We understand that we exist on other people's land and that we are striving for a more perfect union in a deeply, deeply imperfect country. And we are not going to give up. We are under attack by our federal government. There is no way to sugarcoat that. I am not here to tell you that things are actually really not as bad as they seem. They are not only as bad as they seem, there is worse coming at us. So I have to be honest with you. And I also have to say, okay, now I'm going to sit down so that I can look at you all. And I have to be honest with you. The only way we get through this is together. And the only way that we get through this, there are amazing people on this call. There are amazing people on our 12,000 person email list. You are connected in your communities, in your families, through other organizations that you are part of, mutual aid organizations, the nonprofit organizations or local governments where you work or volunteer, your own community groups. This is an opportunity for us to come together and make our nation a safe, equitable, and welcoming place. And it is not going to happen anytime soon. But the ways in which we go about bringing our values into action are going to resonate now and into the future. So I am saying these things not really because I think you need to hear them. It's because I need to hear them. So I hope it's useful as we talk about what I think you all are aware of. There are brutal cuts, the deepest cuts to public food benefits, to food stamps ever in the history of that program that have gone into effect as of September 8th, and there is more to come. There are 2 executive orders since the last time that we met, just a month ago, 2 months ago, because we had a training in between, including a vile, vicious executive order that targets people experiencing mental illness, experiencing homelessness, experiencing poverty in public. And there is an attempt to basically destroy our public health institutions. And we know that armed, masked federal agents or hired thugs are kidnapping mostly brown and black and indigenous people off the streets, apparently with the racial profiling blessing of our Supreme Court of the United States. Okay. Deep breath. This is not normal, and we will not normalize it. We need to share information. We need to be prepared, and we need to not scare folks. So I want to remind you, executive orders are not laws. Executive orders and many of the things that this administration is attempting to do are being challenged by hundreds of lawsuits. Just last week, the National Alliance to End Homelessness sued over the HUD builds grant NOFO. And they succeeded in getting a preliminary injunction that stopped that grant announcement that would have put truly appalling requirements in place for any entity applying for those funds. Here in King County, we and 59 other jurisdictions are part of another lawsuit against HUD and the Department of Transportation about similarly egregious funding restrictions. And we are waiting, still waiting, for the notice of funding opportunity to be released for this year. It's $67 million in this community that we need just to maintain what we have. And we don't know when it's coming, and we don't know if it's coming, and we don't know what restrictions they will attempt to put on that. And it could be less than $67 million that we are even able to apply for. Okay, I say this not to depress you, but to give all of us some of the information we need about where we are. This is information we have been carrying to people in the mayor's office, people in the King County exec's office, city council members, county council members, and people at our state government, so that they and we can understand part of what has to happen is that we together, this community together, set some priorities. Priorities like no one who's currently in shelter is going to lose their shelter. Priorities like no one who is currently housed is going to lose their housing. Priorities like we are not going to punish, arrest, jail, fine, or persecute people who don't have shelter or housing for existing in public spaces. So we have a lot of work to do. Yes, there is a possibility of armed National Guards or federal agents not only doing what they're already doing in terms of alleged immigration enforcement, but coming in the ways that we have seen in Washington, D.C., in Los Angeles, and apparently now in Memphis. I think it is important for us to think about and prepare for that, but not get distracted. Hallie has an action, which I think she put in the chat, about advocacy at the federal level. And we absolutely need our lawmakers, our congressional and Senate lawmakers, to hear from us about the priorities for this budget. We need the federal appropriations not only to include enough funding to continue our programs, housing, shelter, outreach, healthcare, and other services, but to expand them. Yesterday was the virtual lobby day on Capitol Hill that we and some folks maybe on this call, the Washington Low Income Housing Alliance, participated in. It was organized by the National Alliance to End Homelessness. And because Senator Patty Murray is such a powerful leader, she is powerful in terms of her committee assignments. She is the ranking minority member on the THUD, Transportation, Housing, and Urban Development Appropriations Committee. And she is on fire. And she is on fire to defend our freedoms and our public services and investments. We had the opportunity to request that Senator Murray insert language into a continuing resolution to try to protect our COC funding and COC funding across the country. And last night, after our meetings were done, we got a notice from her staff person that she has done just that. We all should thank her, and we're going to think about a way to do that. But obviously, that's just one step. So this is your friendly reminder. I know we have to move on because there is so much more to cover. This is your friendly reminder. We don't win things overnight. We win things over years. We win things over our lifetimes. We win things together. So we are, in the words of our wonderful Nancy Amadei, a mentor and friend, and we'll be sharing some more about her later on, we are working to build the movement. We know we're not going to win all of these battles that we're engaged in now, but we are going to engage. We are going to be strategic. We are going to build the movement, and we are going to back each other up and show up for each other. And the last thing I want to just note is resting is not stopping. So if you need to rest, tap out, tap somebody else in. And with that, I think I have lost my place in the agenda, but Hallie and Kevin are going to help me.
Thanks, Allison. And I went ahead and put that federal appropriations action in the chat. Please do take it now. It just takes a couple minutes to send an email. It's from our friends at the National Alliance to End Homelessness. And this is to help prevent cuts to HUD that are currently keeping people housed. So thank you for taking that action. I'm going to hold my announcements about local advocacy. And if we have time at the end, I'll do it then. Otherwise, I'll just drop some stuff in the chat, or we'll have an email coming to you soon. Because I want to make sure we get a chance to hear from the folks who've come to visit us today from the YMCA. We've got Catherine Boyer here from the Y Social Impact Center to share with us some really exciting resources about some expanded youth mobile crisis teams. So Catherine, I'll hand it over to you.
Hi there. I actually brought my friends who know much more about this than I do. So Luke and Sierra are here from that team to present on what their program is all about. So I'll pass it on.
Thank you. Yeah. And I just want to say, like, we appreciate you inviting us into this space. And Allison, especially, really appreciate your unflinching message about what's going on in our communities and what we must do about it. So we're really excited to share this. In the interest of time, we'll be moving through this pretty quickly, but Sierra will share her email address in the chat. And so if any of you are unfamiliar with our crisis programs and want to learn more, please feel free to reach out to us and we'll have a larger conversation elsewhere. But just to begin with introductions, so I'm Luke, I use he, him pronouns, and I'm the program director for CORE's YA, which is our young adult serving mobile crisis program. In an interim capacity, I'm supporting our after hours team as well. Sierra, do you want to introduce yourself? And I will share screen.
Sounds good. Good morning, everyone. Sierra Moulton. I'm a new senior director with the Y Social Impact Center. I use she, her, aya pronouns, and it is a pleasure to be here today. I want to maybe even offer a little point of hope of something that is actually expanding in this challenging time of cuts to so many critical services. I see this as a small point of hope that we're actually able to move to a regional expansion of our critical crisis services to our children and families in this community. So the YMCA has had the privilege of providing crisis services for several years, but as of just recently, we've been able to expand to a regional model. And I really just want to express some gratitude to King County for supporting this model. I feel proud to live in a place that is still trying to do right by our community by offering these critical crisis support services to families and kids in need. And so you can move us to the next slide, Luke. So to define what is mobile response and stabilization services, so this is a very low barrier, really no barrier access for kids and families who can access us through 988 or through our wonderful colleagues at Crisis Connections. And we are a 24/7 service that go out, much like our colleagues at the Street Medical Outreach. I see why we were perhaps combined today. We go to where our clients are at. And the philosophy is that the family defines the crisis, which means that when they call in, there's really not much screening to say, oh, maybe you're not in crisis enough, or that doesn't sound too hard. Like, it is up to the child or the family to say, we need help right now. And so that barrier is gone. We also have been able to have faster response time. So we've gone from trying to serve all of King County with a small team to dividing up regionally so that staff are more familiar with the resources in the regions they're responding to. There's also we're also lowering barriers to care. For example, youth don't have to be tiered or not tiered. Even if they are tiered with a mental health provider, we can still respond. And so we're moving toward increasing our staffing to better serve the needs. Now, it's of course not a good sign that there's a need for this, but I think that the need in our community, as we all know, the needs are increasing, and so therefore, so does the need to respond increase as well. And so we're grateful at the Y to be expanding our services. Personally, I'm new to this team because of cuts to the refugee and immigrant space, where I've been a social services provider for many years. So I just feel so energized and hopeful and excited to be to be joining a team and helping to lead a team that is stepping up into the gap to serve the needs of children and families in our community. So I'll pass it to Luke to get into a little more details about how we are doing this. Oh yes,
Okay.
and here's a map, just so visual to like show you King County's real big, folks, as we all know. And so having more folks and being able to break up into more regional pods is going to allow us to meet the needs more quickly and more efficiently, and hopefully more effectively as we have. These are our 3 service areas, so you can take a look. And now I'll pass to you, Luke.
So just giving a quick overview of kind of like how this works, and then again, like this is kind of just like a quick overview of the programs, and there's a lot kind of more nuance beneath it. So, you know, as Sierra mentioned, we're breaking down into 3 regions and having regional teams assigned within each of those. And we have this unique opportunity being part of the YMCA of Greater Seattle that we can develop partnerships with each of the YMCA program sites. So those traditional swim gym locations or other administrative spaces, and really use that as places that our teams are gathering and triaging and then dispatching into the community from. So it's like a very helpful position for us to be in to have these resources in place already. For those of you who might be unfamiliar with the CORES programs, so our outreach structure is that for kind of emergency dispatch, you will see a pair of a clinician, so master's level clinician or otherwise individual who's able to do clinical assessment, paired with a peer certified individual to respond to kind of immediate emergent crisis dispatch. But where we differ from some of your traditional, mobile crisis teams and whatnot, and I would argue where we kind of do our most impactful work, is that we have the opportunity to then enroll families like youth, young adults, and families for up to 8 weeks of stabilization services. So that's really a time where we kind of create this wraparound team and kind of walk alongside the family and see like what gaps we can help them fill, and hopefully, help them avoid these kind of crisis events in the future. And we have specific peer roles specialized to meet those family needs. So for instance, we have parent partners who are parents who have had, who have raised kids who have had, maybe like behavioral challenges or interaction with all the different systems that our families interact with, or youth peers who are closer to the young person's age and again have this experience with similar systems, because we really value what a peer can bring to these services with families. So we are a 24/7 program. Like we're a free program, 24/7 program. Oh, sorry, one moment. I think, okay, yeah. We're a free 24/7 program. And as we kind of alluded to, we have like a kids and families program and then a young adult serving program. Because we're 24/7, we are available overnight and on weekends. And for those teams specifically, whereas our day teams are separated out into those individual populations, our after hours teams are merged. So, as supporting regional model staffing, we've kind of created this cross-trained team of clinicians and peers that are kind of prepared to respond to and support and pass down across this whole spectrum of populations. It's a big lift hiring wise. We're really lucky to be in the position we are with the funding the county has been able to provide. Of course, going from select teams covering the whole county to really providing true adequate coverage for the entire county takes some time, but we have since March hired about 25 different staff, and we've got around 20 still to hire. So if you have any networks where you'd like to kind of promote some of our roles, we'd be happy to share those with you. We've also had some latitude to create kind of unique positions to support triage, case assignment, and reporting. So like creating regional coordinators where we are elevating direct care staff who are now in the role of helping their teams game plan around multiple dispatches, multiple stabilization services at once. So it's been a really unique but enjoyable challenge. And that is all we have. So I'd like to turn it back to any questions you might have.
Thank you all so much. That is always, it's so refreshing to hear about a new resource during a time when we really, really need them. Thank you so much for joining us. And I might invite folks, if you're able to stick around a little bit, just to hop in the chat and ask you questions, if that's okay.
Sounds good.
Just one question for you before we move on. Was this funded through the crisis care levy that was approved in King County? Yeah, perfect.
Yes.
Yes. So this is a great example of how work like this doesn't just happen on its own. This was the result of many years of advocacy, really fighting for that levy that was overwhelmingly approved by voters in King County. So this is really where the rubber hits the road on that levy. And that is just such exciting news and a perfect segue to our next presenter. We've got Ida Bell over from King County, who has some updates to share about the Seattle Crisis Care Center.
Good morning, everyone. Can you hear me?
We can. You're a little quiet, but
Oh.
we can hear you.
Okay, I can be louder. That's never been a problem for me. It's so lovely to be here amongst so many friends, new and old. And I'm very excited to see you all and wanted to just give some quick updates. Thank you for our partners at the Y for their CORES update, because that's one of the newest things that's going on with us, as well as the adult mobile crisis teams. We have increased that number of crisis teams around the county as well. And I just wanted to let you know that last week, the county Budget and Fiscal Management Committee met and moved the sale of a new building forward for us. We are looking to buy the old polyclinic site on Broadway in Capitol Hill to be able to use that as a crisis care center. And the next move is to the full council, and that is in theory en route to happen October 7th. There will be an opportunity for public comment at that meeting as well. And if all goes well, we will be able to buy the building by the end of December. And then they will start working on the renovations that need to happen. And the plan is that that crisis care center will open 2027. And that would be our second crisis care center of the 5. And we have some funding opportunities that are open right now. We have requests for proposals open for the Crisis Training Academy so that we can grow our crisis workforce. And we are also doing an RFP for mental health residential treatment. And we are also back to doing our community update meetings once a month. We just had one on Tuesday, and our friends from Crisis Connections came and presented about 988 services. And the next one will be our mobile rapid crisis response teams will be presenting. And if anyone needs to get a hold of me, wants a presentation, has any questions or needs more information, I'll put my email in the chat. Thanks.
Thank you, Ida Bell, and thank you for letting us know that that council meeting is going to be October 7th. Y'all mark your calendars. If you want a crisis care center in Capitol Hill, we need to speak up for it. There is some significant opposition, as you can imagine, to putting a crisis center anywhere. And we need folks to speak up. Allison spoke up at the last council meeting, and we would love to have folks joining us on October 7th. And we'll be sure to send out more information about that once it gets closer. Idabel, thank you so much. And I think I'm going to pass it off to Kevin for our member announcements.
Hello, everyone. Yes, we're a little short on time, so I want to make sure folks who did have community announcements, if you plan on sharing one, I just want to make sure that you either raise your hand or just start prepared, because we do have some time. As far as our announcements, really just touching base on next month. It's slightly different with our meetings. We have the mini meeting at the normal time, and then the in-person meeting. Please get that on your calendar, October 30th. Of course, our SSI, SSDI training on October 28th. I see hands up. Neil, I think I saw yours first.
Yeah, thank you so much. Neil Simpson, I work at Solid Ground on the communications team, and I wanted to let everybody know about an event we have coming up on Wednesday, October 15th, and it actually ties in directly to what we were hearing about earlier in terms of the future of human services and social justice, given the current federal administration. So this is the latest in Solid Ground series of social justice salons that we've been doing over the last few years. It's going to be at Town Hall Seattle. Again, Wednesday, October 15th, 4:30 to 6:30. Tickets are on a sliding scale of $0 to $10. We don't want it to be a barrier for anybody who'd like to attend. And it's going to be a panel discussion moderated by Naomi Ishisaka from the Seattle Times. And the panelists, we're going to have Rhonda Banchero from DESC, our own Shalimar Gonzalez, our CEO, Regina Malvoy of United Way of King County, and then Estela Ortega of El Centro de la Raza. It's going to be a great conversation. We're going to be talking about what's happening, what's going to happen, everything Allison was talking about earlier. It'll be part panel discussion, part Q&A. So the best parts of these events are always the conversations between the audience. So please come with questions and ideas you want to share. It's not broadcast live, but we will record it and have it available afterwards if you're not able to make it. But again, it's a really great conversation. So it'd be great if you're able to make it there in person. And please invite your community. We have a media kit we're just putting together. If you'd like to put it on a calendar or share it on social, please just reach out to me and I'd be happy to provide that material. So thank you so much.
Thank you, Neil. I put a link in the chat. Tanita, do you want to go next? I see your hand, and then Laura after.
Sure, I just have a quick update, and it has been shared relatively widespread, but we, Mary's Place, are going to be opening a shelter. We are partnering with Lehigh, and we will be occupying the Glen. So we will be operating 140 beds, family shelter, and we are going to be prioritizing our WAMAS contract. And so families, so asylum seekers is going to be our focus group that we're going to be prioritizing in that space. And we already are occupying the building. We're just waiting for some tenant improvements to happen, and we hope to start bringing folks in early October.
Awesome. Thank you so much. And then we have Laura from the library. Go ahead.
Hey folks, good morning. Nice to be with you all. I just wanted to share an event happening here at the Central Library with a few folks, leaders in the community, talking about the horrible trends that we were talking about today, criminalizing homelessness both at the state and federal level. So this grew out of Josephine Ensign's latest book. And so she will be talking about her book and then in conversation with some other folks that she's invited in. So that event is next Thursday, September 25th here at the Central Library. And I'll put a link to that in the chat as well as a registration, but we'd love to see folks come out and just be in conversation with us about it. So appreciate it.
Awesome. Thank you, Laura. Danielle, I'm not sure if you were going to read, but I believe we had an update or just a quick update from our friends at the Wheel Shelter.
Yeah, just wanted to share that the Wheels First Presbyterian Shelter is closed for this week and possibly longer. Women currently in their overflow program can remain, but new walk-ups cannot or will not be accommodated. Wheels going to be evaluating this on a weekly basis and updating the community as they can.
Thank you, Danielle. I know we're wrapping up here. We just have a couple minutes. Of course, you're always welcome to stay. I mean, we'll stay on for a few extra minutes if people have other announcements, but we know folks have places to go. Megan, if you want to come off mute and talk a little bit about Project Cool, this is our first time actually all meeting together. I'm going to drop a link in the chat if anybody wants to see pictures from the project. But we wrapped up at the beginning of August. And Megan, go ahead and tell folks about the work this year's Project Cool.
Yeah, it was an incredible experience. I know many people on this call have been doing Project Cool for a decade now. This was my first year, and it was really awesome. We made about 1,800 bags with 80 volunteers in the community, and we do still have a little bit of overflow. So if any member orgs need any backpacks for this school year, please reach out and we can see if we can help out with that. Yeah, that's it. Passing it on.
Thank you, Megan. And yes, we are here at 10:30. Again, I just want to honor everybody's time. We know you are doing important work. We see the work that you're doing. So please, by all means, you're welcome to leave. But since we are all here, if anyone does have other announcements, links that they want to drop into the chat, we're more than happy to highlight those. And then also we'll end our recording as well if we have